Now that we've gone over the basics of analyzing the maxilla in all three views, let's go over some examples. Before we start with our first example, I just want to highlight a point that I made in the basics of CT scan interpretation video. Remember, I always said to look for the cuts on the scan that you're looking at and to make sure they're as thin and as low as possible. Here you can see on this viewer, they display the millimeter cuts at the bottom of each image. I just want to show you what a 2.5 millimeter cut window would look like. Scrolling from the mandible to the maxilla, you can see how wide the cuts are and how much information is skipped over between each cut. In fact, scrolling through the entire scan is very quick because the cuts are so wide. However, although this is useful in other parts of the body, when it comes to a CT facial bones, we want to be as low and as thin as possible because some of these fractures are very minimally displaced and only in one plane, so you want to give yourself the highest chance of seeing them. Let's compare that now with this view, which has cuts of 0.625 millimeters. As you can tell right away, it takes longer to scan through the image, however there is much more detail and much less distance in between the cuts. This facilitates our analysis greatly. In this particular example, starting off with the maxilla, as it comes into view, right away you notice something when it comes to the anterior teeth. There seems to be a line going through this tooth, which would be 2-2. This is our midline, so this would be 2-1 and then 2-2, or our left upper lateral incisor. And in addition, with 2-1, the shape doesn't seem to be symmetrical. There seems to be something missing or fractured here as well. Remember, it's not always important to identify which fracture you have right away as soon as you see it, but more just to recognize abnormal from normal. Right away, we can see that with teeth 2-1 and 2-2, there seems to be something abnormal. After I've scrolled through the rest of the scan following our normal protocol, I've determined that there are no other fractures except I think something's going on with 2-1 and 2-2. After pulling up a second view, I'd like to go to that area again to take a look. It appears when it comes to 2-1, there is no crown. Although the root is intact, there seems to be a fracture line here, and the crown of 2-1 is missing. This could be old or new, and would need to be correlated with the patient's history. In addition, when it comes to tooth 2-2, we can see a fracture line running just beneath the crown, although the crown is still in place. Finally, we'll check our sagittal view just to visualize it again. For 2-2-1, we can see the root, but the crown is missing. And for tooth 2-2, we can see that horizontal fracture line running at the base of the crown. This example illustrates just how important it is to always start at the junction of the mandibular teeth and the maxillary teeth, or else you may miss a fracture in the teeth or the dentoalveolar process. Let's go to our next example. After scrolling into the maxilla, sometimes you'll realize your view will be obscured right away by artifact from dental amalgam fillings. Unfortunately, there's nothing you can do about this, and you'll just have to do your best to still analyze the maxilla and mandible as best you can. Assuming I've analyzed the entire maxillary alveolar process, all the teeth and the sinuses, and found no fractures, I'd like to turn our attention to the pterygoid plates. As they come into view, I'll focus on one side at a time. First, let's look at the right side. It appears we can see both the medial and lateral pterygoid plates. They seem to be continuous, no step-offs or deformities, and no fractures seen. Moving over to the left side now. As we're scrolling through, there seems to be a discontinuity in the lateral left pterygoid plate. And indeed, in one area, we seem to see two of them next to each other. This indicates an overlap, or that one area was fractured and displaced. In addition, when it comes to the medial plate, although it is very subtle, there seems to be a break in the continuity here. However, I cannot be sure that that's a fracture at this point. I'd like to double check these findings in the coronal view. Unfortunately, this patient did not have a dedicated CT facial bone scan, and they did not produce the coronal views. Although sometimes you can replicate this from the axial view, sometimes the reconstruction isn't as good. The patient did, however, have a CTC spine, which, although not ideal, will illustrate the point we're trying to make for this particular fracture. Here we can visualize the pterygoid plates in the coronal view at the superior portion of the CTC spine scan. As we scroll back, once again, on the left side, we can see a break in the pterygoid plate indicating a fracture. And here is that overlapping segment we spoke about before. At this point, you can confidently say there is a fracture of the left lateral pterygoid plate. When it comes to the medial pterygoid plate, once again, there is this area that seems to have a break in the cortex, although it is non-displaced. This is a very difficult call. However, I would lean towards saying there is a mild non-displaced fracture of the medial pterygoid plate. As it turns out in the radiology report, they did report a left lateral pterygoid plate fracture and a non-displaced medial pterygoid plate fracture. The point of this example is to illustrate how important it is to check your pterygoid plates on both sides. Remember, a pterygoid plate fracture is required to have a Lefort fracture of any kind. As you can tell, sometimes it'll be a little bit easier to see a fracture, in this case on the left lateral side, but other times it can be very challenging, as shown on the medial pterygoid plate of this example. Always look at your axial and coronal views, as it will give you the most information and give you the best possible chance of diagnosing these fractures. Our next example will show some maxillary sinus wall fractures. Right away on this scan, you can see on the left side, there's some radiopaque material within the sinus. This is your first clue that there could be a fracture involving the left maxillary sinus. As we scroll through, looking at the anterior wall, right away you can see a bump and a step off in the anterior wall. This displacement shows the fracture of the anterior wall of the left maxillary sinus. For comparison's sake, you can always look at the opposing side and notice how smooth this wall is compared to this side. After looking at the anterior wall of the sinus, it's always important to look at the posterior lateral wall of the maxillary sinus here. As we scroll through, we can see another defect here. It becomes more clear as we go further up. This shows a clear fracture in the posterior lateral wall of the left maxillary sinus. Once again, comparing to the other side, you can see a smooth outline here versus a jagged, broken outline here. At this point, we'd be comfortable saying that there are fractures of the left anterior and posterior lateral walls of the maxillary sinus. In this particular patient, most likely related to a ZMC fracture. However, we will go into more detail on that in our ZMC section. Our last example will focus on a more complex case from blunt facial trauma. As we examine the maxilla, it's important to take it step by step and not be overwhelmed with a large amount of fractures. In addition, you can see the quality of this scan is not as good as some other scans we've seen. The quality of the scans you look at will depend on the machine that was used, the institution it was taken at, and whether or not you're viewing it on your own server or another hospital server. Nevertheless, if you take it as a stepwise approach, you should be able to observe all the detail you need to. As we scroll through the maxilla, on the left side, we can see an obvious anterior maxillary wall fracture. In addition, the posterior lateral wall is also fractured. Looking at the right maxillary sinus, once again, we can see an anterior wall fracture and a posterior lateral wall fracture. The medial walls of the maxillary sinus are also fractured. Once again, we can see our maxillary sinuses are filled with radiopaque material, most likely blood, giving us a hint that there are sinus fractures, although in this example, they are quite prominent and obvious. Although our alveolar segments seem to be intact for now, we'll make sure to double check that in different views once we get to them later. For now, let's scroll back and look at our pterygoid plates. It appears these fractures of the sinuses extend to the pterygoid plates, and we see separation in both the lateral and medial plates on the left side. In fact, it's actually difficult to visualize the entire medial plate because it is fractured and displaced. On the right side, once again, we see fractures of both the medial and lateral plates. They seem to be extending from the sinus walls and going all the way posteriorly. This will become more obvious when we look at our coronal view. Looking at it from the coronal aspect, right away we see that fracture in the nasomaxillary region on the left side, as well as on the right side. This complete lack of continuity shows us that there's fractures on both sides in this region. Scrolling backwards, we can see the sinus wall fractures we were talking about before, as well as a fracture at the zygomaxillary junction. This is on the right side, as well as on the left side. As we scroll more posteriorly, we can examine our pterygoid plates. Starting with the left side, you can see fractures more easily on the medial and lateral pterygoid plates here. As you can see, there's a complete lack of continuity on both sides with the step-off, showing fractures at both plates. Similarly, on the right side, we can see gross comminution of the pterygoid plates, as both the medial and lateral plates are quite fractured. So to summarize, we're able to see fractures at the nasomaxillary junction bilaterally, the zygomaticomaxillary junction bilaterally, as well as the pterygomaxillary junction posteriorly. This indicates a fracture completely across the maxilla, and thus we would diagnose a Lefort 1 fracture.